It looks like you all are raring to go. So are we. So let's officially kick off our Maxicare Wellness Fridays. Welcome to Maxi Life Wellness Fridays featuring first aid in children. Again, I'm Patricia Bermudez. He's on your host for this event. Speaking and listening to children are crucial factors when attending to their medical needs. Whether it be at home or outside, it's important to know the best practices in providing emergency or immediate care to them until further medical treatment can be made available. So let's discuss the value of first aid when dealing with a pediatric age group. It's time to meet our speaker. He is currently a consultant staff and a member of the training faculty of the Department of Emergency Medicine at the Makati Medical Center. He's also the head of emergency medicine at the University of the East Ramon Magsaysay Memorial Medical Center and a consultant for emergency medicine at the Victor R. Potenciano Medical Center. We are happy to have with us here in our Maxicare Wellness Fridays, Dr. Daniel Luchanco. Hi, Dr. Dan.
Hi, Patricia. Good afternoon. Thanks for having me here.
Oh, looking forward to it. I shared, Dr. Dan, that I have teenage boys, and somehow I don't remember first aid, but having two boys who are now teenagers, they had a lot of accidents. But now
Yep.
that I have a baby girl and she's 1 year old, parang I panic. So this is going to be very timely for me, as well as the majority of the parents. You saw in our poll, right? We have so many
Yep.
parents in attendance.
Yeah, actually, so it's really different when you're talking about your own child. So even if you're normally very calm and collected, this is something that can totally go out the window when it's your child involved. And we do see a lot of panic parents at the ER.
Oh, guilty. So go ahead, Doc. Let me learn some more from you. Looking forward to this presentation.
Okay, thanks, Patricia. I'll just share my slides. So I put together a course that I call Baby First Aid. So just a little bit of a history about the course. I am an ER doctor, and during our course of work at the ER, we see a lot of emergencies, and of course, some of them involve children. And what we've noticed is that a lot of times the parents will bring in their children, and of course, they're panicking. And this is something that has happened to them for the first time, and they don't know what to do, and they feel guilty, and then they feel confused. Sometimes you don't even know if you need to bring your child in or not, you know. And for the parents, it's the first time, and it's a big event for them. But for us in the ER, it's pretty much the same cases again and again. And so sometimes we wish that we could have told the parents how to prepare for these things, or what to expect, or what to do when they happen. And so we just thought of putting it into a course, and I've been teaching this course for about 10 years already. And so we've been teaching it in schools and in people's houses, in fact. So today we'll just give you a quick excerpt of the important. We'll try to squeeze in the important emergencies involving children, but also importantly, I think later I'm going to do a demo of CPR, or cardiopulmonary resuscitation, in children and infants, as well as the management of choking in case your child is choking on something. Okay, so this is just a quick version of our baby first aid course. Okay, so I know it's late in the afternoon, and maybe you guys are getting a little bit sleepy. So just to jog your brains and wake everyone up, I'm just going to ask you guys a pop quiz. So the topic of the quiz is a little bit morbid because we are discussing emergencies in children, and we have to be able to prepare ourselves. No one likes to think about children in danger or hurt, but we have to be ready for that if we are going to be the ones to react. Okay, so the question for the pop quiz here, and you can put your answers in the chat box or the Q&A, is what do you guys think is the leading cause of death in children below 5 years of age? What do you think is the leading cause of death in children below 5 years of age? And we have some choices on the screen here. So you guys can just think about it. If you want to put your answers in the chat, and then we'll get on to discussing that soon. Okay, so I see a lot of A's, B's, so it's a good mix actually. So actually, all of the answers on the screen are good enough answers, except for letter C, heart disease. No, because the heart disease is the leading cause of death in adults, and children tend not to have heart disease, so that's not typically something that they die of. No, we'll look at the this table here. It's a busy table, but we're going to be focusing in here on the, we said below 5 years old, right? And ranking one here. This is from CDC, Centers for Disease Control in the US. And we can see that unintentional injury here is the leading cause of death, not only below 5, but all the way up to 35 to 44 years of age. No, so the correct answer in the quiz would have been accidents. No, however, take note that's US data. No, and the US has a very advanced healthcare system. And so children are not supposed to get sick. And if they get sick, they're supposed to be able to get treatment. And so they wouldn't die from those illnesses. And then by default, the cause of death would be accidents. No, in more developing countries like ours, that changes a little bit. We have a little bit of infectious disease creeping in, pneumonia, diarrhea. Unfortunately, people still do die of dengue. No, and that factors in. No, however, I think fortunately for most of us who are attending here, if you're in Metro Manila, if you're a Maxicare member, you have good health care. No, so hopefully you wouldn't you'd get good health care when you need it, and you wouldn't have unnecessary deaths. No, and then by default, accidents would end up being the number one cause of death. Okay, so injuries are the leading cause of death in children. Accidents can happen anywhere. So at home is where they frequently happen because that's where your child is the most. But it can happen in school when you are not with them and they are being watched by other people. At the playground where they're just horsing around. And the question we have to ask ourselves is, would we know what to do if our child was in an emergency? And that's what we'll try to cover today. Okay, so what I have here on the screen now is the American Heart Association Pediatric Chain of Survival. So I also teach CPR for the American Heart Association. And what it shows here is the links to making children survive cardiac arrest. If we start from the very right here, we have the ECG tracing icon, which symbolizes advanced medical care in the hospital, in the ICU. In order to get there, you have to go there in an ambulance, or someone has to bring you there. And in order for you to get to the hospital, someone has to have called the hospital or the ambulance. Therefore, they have to have realized that there's an emergency that we have to address. And that's also an important link. And you see the two hands there, which symbolizes CPR, which tells us that early CPR saves lives. So when somebody needs CPR, that's not something that we can wait for 15 to 20 minutes to get to the hospital to do. Someone has to do CPR on the scene right there in order to improve the chances of survival for that cardiac arrest patient. And the first link on the very left side here is only present in the pediatric chain of survival, not in the adult chain of survival. So it's an icon of a child wearing a seatbelt. Okay, please don't belt up your children that way. That's wrong. But it's just there to symbolize prevention. Because if accidents are going to be the leading cause of death in children, then preventing accidents is the best way to prevent deaths in children. And that's what we want to emphasize today. Okay, so frequently asked questions in this course: what can I do as first aid? When should I bring my child to the ER? Do I even have to bring my child to the ER? And what can I do to prevent injuries? So that last question maybe is not asked as often, but I think it should be. Okay, so as I mentioned, I have a bunch of topics in this course. We'll have to have trimmed it down for our format today. So we'll try to cover as much as we can, and then we can see if we can cover the rest in questions. So we'll be dealing with cuts and wounds, burns, head injuries, broken bones, nosebleeds, seizures. That's page 1. And then we'll be doing a demo of management of choking and CPR in infants and children. I just want to emphasize that the physical skills of CPR and management of choking should be learned in a hands-on live class with practice mannequins if you're really going to be able to master these skills. But I'll just try to give you an overview today. Okay, so I'm just going to breeze through the topics as quick as we can to try to cover as much as we can. Okay, I'm going to start out with cuts and wounds. By the way, I'm going to be showing some pictures of the injuries and accidents, no, and so some of them may be a little disturbing, but that's part of what we need to be able to do, no. We need to be able to see these things and not be very bothered by them ourselves, no, because we have to be the ones to act. Okay. Um, so first off is just a diagram of the skin under a microscope, and we can see the outer layer is the dead skin cells that are sloughing off as our skin grows, and we have the epidermis. And in the dermis, we have some blood vessels there. And then under that, the nerves. And then the yellow part is subcutaneous fat. So just that we have an idea that even though skin is very thin, it has layers. And that factors in to how we deal with them and how it heals. No? So just an example, when we have a wound, it could go through various thickness levels. And that will affect how we deal with that. There are several different kinds of wounds, like an incised wound is caused by a sharp object. Lacerated wound is caused by a blunt object. An abrasion is scrapes, but very superficial, but that's quite painful because you can see it's in the layer where all the nerves are. So there are various different kinds of wounds, okay? I'll show you some examples of wounds. No? So the first one, well, it has a little blood in it, but it's maybe not as distressing. So this would be an abrasion. As you can see, the wounds are very superficial, but spread out over the surface. This is quite painful because that's in the layer where all the nerves are, okay? The next picture will be something that we see quite often in the ER. It's a forehead laceration. Laceration comes when you have blunt trauma, which means you hit it on the wall or something like that, and the skin pops open. What I want you to see here before I show it to you is that there is a fish mouth of the skin where the skin pulls. And when the skin breaks, then it causes that kind of a fish mouth. And that's what we have to close or put together. That's the challenge for it to heal. Okay, so just a quick picture of that, a child with a forehead laceration. Normally this would be bleeding a lot, so in this case, the bleeding has probably been controlled. No? Then we also have incised wounds, which are caused by sharp objects. And what we can see here is the subcutaneous fat. So based on the diagram I showed you earlier, you can see what the layers are, the epidermis, the dermis, and then the subcutaneous fat, and that's where we are now. No? But it's not quite so deep as to reach the muscle. Okay, so what do we do when we first encounter or see a cut or a wound? The first thing we want to do is we want to rinse the wound thoroughly in tap water. So you can see in the picture, they simply put the wound under tap water and we're rinsing that out. No, so I think many of us have been programmed before to reach for the alcohol or the betadine whenever we have a wound. No, why are we saying tap water here? So they've done several studies on the irrigation or initial cleaning of a wound, and they did use tap water, sterile saline solution, betadine alcohol for initial irrigation, and found that there's no significant difference in infection rates for wounds that are cleaned with these different agents at the initial cleaning. No? And tap water being the most accessible is a good choice. So let's say if you're out in the mall or if you're in someone else's house or in a restaurant and there's a wound there, you may not know where the first aid kit is or where to get betadine or alcohol, but you can surely access a faucet or even a bottle of water and run water over that. And the reason we want to do that is because our skin provides a layer of protection, which keeps germs out and keeps our moisture in. And there are germs on our skin, but it's okay that they're on the surface of the skin. That's normal. But when that breaks, the germs can go in as well as dirt from the outside can go in as well. And what we want to do first is just remove everything that's not supposed to be there from the inside. And that's why we use the mechanical force of the water to just push all the dirt out. Water goes in, picks everything up, and goes out and brings it out again. So the first thing we want to do is really just rinse the wound thoroughly in tap water as soon as possible. Okay, next thing is we want to apply direct pressure and elevate the wound area. Okay, the pressure is to stop the bleeding. So our blood vessels run through our whole body, and they're actually flexible, malleable tubes, and the blood flows through them. And we all know that blood will clot if it's exposed to air. But if the blood is flowing too quickly, it won't have time to clot, so it keeps on flowing. So by pressing down on the area, you're closing the blood vessels, slowing the blood flow, and allowing that blood to clot. So most of the simple trauma that you see or encounter, you will be able to stop the bleeding simply by putting pressure on it. But like on TV also, when they get shot or something, they just say, press down on the wound, right? And that is to compress all the blood vessels. So here, we can see that it's probably healthcare setting. So they have sterile gauze, they have gloves, but really just whatever clean thing you can do to press down on the wound to stop the bleeding. And if you elevate it, it helps for gravity. So we've washed it, we've rinsed it out, we apply pressure. and elevate it to stop the bleeding. Okay, then we can have time to evaluate when do we have to bring our child to the ER. So if the cut is deep and the edges are widely separated, that might have to be seen in the ER. If the cut continues to bleed even after applying pressure, then we might have to look at that a little bit more deeply. If the cut is from an animal or a human bite, yes, that does happen as well. No, so this is considered quite a dirty wound, and so we have to treat that specially. Obviously, if there's a body part like a fingertip that gets cut off, then we have to bring that to the hospital. No, incidentally, if you want to have a, it's not very easy to reattach disconnected body parts, but if you want to have a best chance to do it, you want that part to be cool and moist, but not soggy, right? So recommendation is to put the part, if you can get it, in a clean sealed plastic bag and place a Ziploc bag, and then you put that in ice so that it gets cool, but not soggy. Because sometimes it comes in a cup of ice, and then by the time they're in the hospital, the ice melts and now it's floating, right? So anyway, so I'll show you a little bit about how wounds heal, right? So when there's a wound, obviously there's blood, but the body also throws in a lot of fibrin there. And the fibrin tries to reach out and close the wound edges so that there's a temporary barrier while the skin grows from inside going out. And that's why we usually have a scab when we have a wound. And then eventually the scab falls off when the skin has grown from under and pushes the scab off, right? And so in order for us to our wound to heal and to have the least possible scar, we need to put those wound edges as close together as possible. No? And that's why we sometimes will stitch, no? Because we'll pull the wound edges together with the stitch and put it right next to each other so that the fibrin doesn't have to travel so far and we don't have a big scab and therefore smaller area that might form a scar. No? If the wound is not close together, maybe the fibrin won't reach, we can't close the wound, it becomes susceptible to infection and not healing at all. No? So that's one possibility. So that's why we want to put the wound edges closer together. Okay. So stitching is one way, but in the hospital we also have a skin glue that we can use in some cases, but not all, and that can help keep the wound or hold the wound together until the skin is able to grow in about 5 to 7 days. Okay. Of course, we would rather not have wounds at all. And so prevention is important. So remember, Patricia mentioned she has a toddler. I have a toddler as well. And they just love to explore and see the new things that they can do. They'll challenge themselves. They'll try to open everything, lift everything. And so there are some child-proofing things that we can do. Just remember that your child will surprise you at what they can do already that you thought they couldn't do. So we should also watch them when they're using scissors and other potentially dangerous objects. We need to teach them how to use these things properly because they will get into these things when we're not watching them. Okay, so obviously wearing footwear will help prevent them from stepping on things. Personally, I was a barefoot child. I would run around the house, the garden, even the street barefoot, but we need to protect also our feet. But we should also be wearing properly sized footwear in order to prevent falls. No? Okay, so that's basically about cuts and wounds. The next thing I'm going to do is talk about burns. Hopefully, we can discuss questions later on. No? The burns I'm going to talk about today are the most common burn that we see in the ER, which is a scald burn. A scald burn is caused by hot liquid. So that's by far the most common burn that we see, especially in children. So if you think about it, it's not so surprising. There's hot liquids all over the house. As adults, we're used to knowing that this is dangerous and that's dangerous. But to a child, some of the hot liquids may be the most important, most interesting things, right? They smell good, it's glowing, you know, it's making interesting sounds, so they may try to reach for these things. And often that's the cause of the scald burn. No? So for burns, we know, most of us will know that there are different degrees of burns. There's first to fourth degree burns. No? So first being the lowest level and fourth degree being the worst. No? And which among these burns do you guys think is the most painful? So first degree or first, second, third, or fourth degree burns. We'll discuss that later. No, I'm going to show you some pictures of burns also. Obviously, that's not pleasant, but I want you to be able to identify, you know, things that you need to look out for. Okay. The first kind of burn I'm going to show you guys is a first degree burn. So get ready for it. Here's an example of a first degree burn. Yeah. So actually, a sunburn is a good example of a first degree burn. So of course, it's kind of cute in kids, but so what are the characteristics? The skin is red, it's warm to touch, it's tender if you touch it. there's no break in the skin. No, so a sunburn is a good example of a first degree burn. But aside from sun exposure, we can get first degree burns also from hot liquids as well. No, and so if you see it this way, red, warm, no breaks in the skin, no blisters, this is a first degree burn. We should also take note that first degree burns may progress to second degree or third degree burns within a few hours, no, after the burn itself. I'll show you guys second degree and third degree burns also. Of course, these are less cute pictures, but we want to be able to identify. So this is a second degree burn. So you can see the blisters here. So there's blisters and there's a breaking of the skin in some portions. This is a third degree burn, which burns right through. I don't need to show you guys fourth degree burns anymore, which burn right through the muscle. And that probably won't happen in normal household settings, okay? So what do we do in cases of burns? No? So we want to run tap water over the area of the burn. This is not a recycled slide. This is different from earlier. Earlier was a wound, right? And now it's a burn. But just so happens we do the same thing. We run tap water. And why is that? Well, we don't really want the area to get from very hot to very cold. So there's no need to put ice on it. What we want to do is bring it back to room temperature. And also we want to remove any of the offending agent that might still be there. Like if you spilled coffee or soup there, we want to wash that out, remove that so the burning stops happening. And the water will help pass over the burn and take the temperature away. Just like, let's say you're thawing a steak, you take it out of the freezer, right? You don't put it in the microwave. Instead, you put it in water, right? So that the temperature can kind of diffuse, right? And that's what we do for burns as well.
I wanted to jump in. Obviously,
Yeah.
You know, it's common for children and even for adults to have burn. You can hear my little child trying to talk to me as well. But it's just that there's always that notion, oh, lagyan mo nito, lagyan mo ng
Yes, exactly.
on that. And I just wanted to jump in to make sure that we're actually trying to clarify that notion. But also, I think I'd like to see your presentation better. Would you be able to put it on presentation mode?
Oh, isn't it?
So we don't see your notes at the bottom, or we don't see
Oh, sorry. I thought it was in.
No, but all good. But yeah, so Doc, there's always that notion, right? Na lalagyan ba natin to? Lalagyan ba natin ng toothpaste? So I just wanted to jump in because a lot of people think that that's okay. So go ahead, Doc.
Yes, as a matter of fact, that's what I usually do in the course. I ask people, what are some of the things that you think you should put when you get a burn? Because we get all of these things in the ER. So we get toothpaste, mayonnaise, tomatoes, cucumbers. So why don't you guys send in some of the things that you're used to putting or being told to put on burns? You can see some of the answers. Yeah. So there's tomato, there's a toothpaste. Okay, so actually, one of the things that it's really difficult to replace a good burn dressing. So what do we need in a burn dressing? One thing is we need to prevent infection, right? So we want there to be a layer of protection so that germs cannot get in. And also we want to keep our moisture inside. So if you've seen burns, second degree burns, they'll usually weep or have fluids leaking out. And so we want to have that layer to keep all of the liquid in. So this is silver sulfadiazine. This is a generic name of a burn ointment. And so it's quite thick. So the moisture doesn't leak out through it. So it creates that barrier. And it also has antibacterial properties to prevent germs from getting in. So what we'll want to do with burns, sometimes people will say, let's leave it open so it will dry faster. So what we really want to do with burns is we want to cover it with a very thick layer of burn ointment because next we're going to dress it with gauze. And sometimes if you've tried that before to put gauze on a wet wound, then when you take it off, it rips the top of the wound off. And so what we'll do is we'll put a thick layer of burn ointment and we'll lay the gauze on top of that so that when we take off the gauze, only the ointment comes with it. And then it doesn't have any of that leaking fluid outside through the wound or through the gauze. So we really want to put a burn dressing on there, followed by a sterile gauze. So burns are very prone to infection. So we want to cover that with gauze. And then we're going to need to change that dressing. Anytime that we see the gauze soaking with blood or fluid, we need to change that. And if not, it doesn't soak, we'll still need to change it at least once a day and until the skin is able to heal. So we're replacing the skin, the damaged skin, with the burn dressing plus that gauze on top. Okay? When do we have to bring our child to the ER? If the burn area is large, then we need to bring our child to the ER. Just cover the area with a clean cloth or towel, just keep it moist, and bring it to the ER. And remember, when we talk about large burn area, what we're really talking about is percentage body surface area, right? So if I have a burn the size of uh, my hand, that's relatively small to me, but to a child, this could be their entire torso, right? To a baby. So bigger percentage body surface area. And so those ones should be treated in the ER. If the burns were caused by fire, electrical wiring, or chemicals, that's not a scald burn. Those should be treated specially in the ER. If the burn involves the hands, feet, joint, or genital areas, anything with joints, then those should be dressed very carefully because those could stick together and cause deformities when the body parts stick together and then it heals that way, And of course, if you had a burn a couple of days ago and then it starts looking infected, which is they are prone to doing, then we should bring the child to the ER as well. Okay, so we want to prevent burns. Obviously, sunscreen is just going to prevent sunburns, but more safety around the house, identifying dangerous objects, and teaching children to be careful with them. And more child-proofing on dangerous areas for burns. Okay, I'm gonna move into head injuries. I'm just gonna cut off when I also want to make sure I get to demonstrate the choking and CPR. So in case we don't get to finish everything, head injuries is a common cause of bringing children into the ER. So children like Patricia's and my toddler run, jump all over the place. They tend to have get head injuries because they're malikot. And so it's important to remember that our brain is covered by a skull, and anything you can see is probably outside the skull, not inside, or the brain is inside, But we still have to watch out for serious brain injuries, So this is just a diagram of the brain sitting inside the skull. So this is an adult skull. But what you'll see is that the brain is quite tight inside the skull. There's not really a lot of room. And when we're looking at serious brain injuries, head injuries, we're talking about bleeding inside the brain. So just a little bit of blood inside the brain can cause a lot of symptoms. And that's what we should be watching out for. In fact, the World Health Organization, the DOH, has warning signs for head injuries that we have to watch out for. Unfortunately, the warning signs tend to be misinterpreted almost as much as they are useful. And so we want to clear some of that up, and discuss some of the warning signs for serious head injuries. Okay, so one of the danger signs is a loss of consciousness. Okay, so that means knock out, tulog, like a boxer, 1, 2, 3, out. So children, when they get surprised or startled, they tend to space out because they're wondering what's happening. That's not loss of consciousness. Loss of consciousness is they're out cold. Okay, so if you get a head injury and you're out cold, that means that the impact was strong enough to disrupt the consciousness of the brain and knock the person out. And so it's a significant head injury. And so that should be interpreted as a danger sign. Okay, another one is vomiting. So to the parents here, you know that it's not vomiting, it's just a spit up. But anyway, when there's vomiting, it could indicate increased pressure in the brain, which is causing a vomiting reflex, and that could indicate a serious head injury. However, we should also know that, well, those who have children, about 3, 4 years old, what makes them vomit? So they can vomit if they ate too much, if they laugh too much, if they're coughing, if they're running around too much, right? So a lot of things can cause vomiting, and it doesn't mean necessarily that your child has a serious head injury. Headache or pain is one of the signs listed as one of the signs as well. Of course, if I hit my head here and I say it's painful here, then of course it will be painful. But the headache we're talking about is the headache that's like their head is going to explode. There's so much pressure all around. That's the kind of headache that could indicate a serious head injury. And so for children who are nonverbal, they're not yet talking, you may see them banging their head against the wall or with their hand like this, which would indicate that something feels wrong to them. So we should watch out for that as well. Seizures, obviously, is a danger sign. So if you have seizures after head injury, that's dangerous as well. Okay. Excessive sleeping is listed. In fact, we often get parents running into the ER, shaking their child, don't sleep, because they're afraid if they sleep, they may not wake up. So actually, excessive drowsiness is an effect of pressure inside the brain. But we also have to remember that we need to be observing our child for 24 to 48 hours after the head injury for all of these dangerous signs. And that's when some of the bleeding inside the brain can develop. And we cannot keep our child awake for 48 hours while we observe, no? So maybe it's late at night because they were running around at bedtime or something like that. They come to the ER. Of course, they'll be sleepy and they'll want to sleep, no? But we need to get them back into their routine. So we want to get them to rest. If they want to sleep, we can let them sleep. Then we will evaluate them naman, no? Because we'll need to get them to bed so that tomorrow morning they can wake up rested and we can observe how they're feeling, no? Because if we keep them up all night and then the next morning they wake up much later than they're used to and they're all drowsy, we won't know if that's due to the head injury or just because they were kept up too late last night. Okay, bleeding or fluid from the ears after head injury is also could be a sign of serious head injury as well. The ear canal goes deep into the skull, and there's a part where it's right next to the brain. So if there's a serious head injury, there's a fracture in the ear canal, some blood or the fluid that bathes the brain called the cerebrospinal fluid, which is a clear fluid, may start to leak out there, and that's a sign that there could be a deep skull fracture. Okay, so we talk about bleeding in the brain. Isn't there some medical tests we can do to check bleeding in the brain? Yes, there is. We can do a CT scan, and that can see bleeding in the brain. But sometimes we try not to do that. No, it's not because we don't think your child is good enough for our CT scan or that we don't care. There are some conditions that we look out for. So in differentiating between X-rays and CT scans, X-rays, you've seen X-rays, right? They're white. You see the bone in white and everything else is black, right? But it can only see bone. So it can only see a skull fracture in terms of the injury, but we cannot see blood inside the brain with an X-ray. A CT scan can see both brain, blood, and bone. So that's the better way to assess a head injury. No? But the reason we try not to do that, especially in small children, is because it is a lot of radiation. Of course, it's medical grade and it's safe, but it's equivalent to taking about 64 X-rays because it takes X-rays in a series and then puts them together in a picture. No? So we want to avoid it if possible. Plus, remember, even if your CT scan is normal, 10, 20 minutes, half an hour after the head injury, it doesn't mean that we're out of the woods because we need to observe the child for 24 to 48 hours where some bleeding could still develop, you know? And we need to be vigilant for that as well. And if something develops in that period, 48 hours or so after head injury, we will need to CT scan the kid again, you know? So they'll be exposed twice if we take a CT scan too early. Sometimes we decide not to do a CT scan right away and we opt to wait and observe. And who's the best one to observe the child? It's you, yourself. You're the parents who know them best, no? I can see the patient, I'm a trained medical professional, but I don't know your child. I don't know if they're normally malikot, they like to laugh a lot, or they're normally reserved or quiet. I don't know them. So one thing we want to watch out for is changes in behavior as well. So we have to watch out for that if they act irritable or you're not drowsy, things like that. So you know your child best. You're the best person to note these things. Now we should be observing a child, but we don't want to let them know that we're observing because children get heavily affected by their parents' demeanor, right? So if we always look worried, and we say, "Oh, anak, are you feeling okay? Do you have a headache? Are you sleepy?" Then they will get nervous and they will behave differently. No, so we have to be normal. We're chill out on the outside, but inside we're watching them very carefully. We're watching out for all of these danger signs. Okay, of course, the best is to not have to worry about head injury. So protecting the head, especially when doing high-speed activities like biking or rollerblading, is also important. Okay, next we're going to talk about broken bones. I'll probably break off after this to do the demo for CPR and choking. Okay, so for broken bones, this is the most common broken bone for children usually. It's the wrist bone, and it's caused by a mechanism that we call falling on an outstretched hand. No, so we stretch our hand out to prevent our head from getting injured, but in the process, often we fracture one of the bones in our wrist, which is called the radius. So this is a common mechanism. So you don't always have to be a doctor to know if a bone is broken. Obviously, there's something wrong with this hand. This is an X-ray of a broken bone, so you can obviously see the cracks in the two bones that form the wrist. So these are fractures. Okay. Sometimes you can have bruising over broken bones as well. No? So what should we do if we suspect there may be a broken bone? We can apply ice to the area. Of course, the ice won't do anything for the broken bone itself, but in those areas there tend to be a lot of swelling, and that can make the symptoms worse. Putting ice can constrict the blood vessels and reduce the swelling that happens in the area. Okay, then we want to immobilize the possible area of fracture. But it's important to note that we need to immobilize the joint above and the joint below the possible broken bone. So, for example, if I think my finger might be broken here, I need to immobilize it in such a way that I cannot move this because that will move the fracture, but also I cannot move this because that will also move the other end of the fracture. So I need to immobilize this and this. Okay, so I need to put some kind of a splint so that that can't be moved. And immobilizing the fracture itself will help a lot with the pain. There's no nerves in the bone itself. So the pain is caused by the fragments of bone moving around in the tissue. And that's what causes the pain. And often just immobilizing it will reduce the pain that's being felt. So we can immobilize with stuff that we find around the house. For a finger or something, you can use just a pen. You can use a rolled up magazine for an arm, just roll it up and then tie it with a handkerchief or something like that. So there's lots of ways that you can immobilize the body part just to bring that to the hospital. Okay, and bones will heal sometime a little bit like skin. We just need to put the bone parts together properly, and then they will grow into each other and form new bone and become just.
So, with all that being said, I was listening intently with Dr. Dan, and I just want to reiterate some of the things and want to share again some of the things that she said for it. So again, can everybody see my slides?
Yes, perfect.
Yes, okay. So it is first aid in children, and I summarize some of the key points that Dr. Dan mentioned a while ago. So again, the first rule is do not panic. As Dr. Dan initially said, it really is about the knowledge. If we know something, and know what to do, that will decrease our panic, right? But I understand, as you mentioned, Patricia, that sometimes things get in the way and we get emotional, we get panic. So these are the things that we want to reiterate again. For wounds, number one is to rinse the wound thoroughly and apply direct pressure and elevate the area. And for any cut off body part, morbid that it seems, but you have to put inside the cut-off body part inside a clean plastic bag, probably a Ziploc, then place it in ice, but not directly in ice so that it won't be soggy. For burns, you run tap water over the burnt area and apply burn dressing. For head injuries, again, please watch out for danger signs, sleepiness or increase in sleeping time, seizures, severe headache, bleeding, or any fluid from nose or ears. These are the things that Doc Dan mentioned also. The observation period supposedly is 24 to 48 hours. And he mentioned that, not letting our kids sleep after the injury might even cloud the doctor's judgment. Either the patient the next day is sleepy or drowsy because of the injury, or it's because of us not letting them sleep in the first place. Broken bones, again, we have to immobilize that portion that we think that is abnormal, and we proceed to the ER so that X-rays or imaging can be done and consultation with a doctor can be done, and that's when we know the extent of the broken bone or the fracture. For choking, under 5 years old, do not let them eat round, small hard food. Quarter them, just like the Doc Dan emphasized with the grapes, even cherry tomatoes. Make sure no choking hazards around from the toys, from all the things that we have around, nothing that the patient or the kid or a toddler can get their hands into and put in their mouth. So make sure they don't have. Then we have to classify all choking incidents, either a mild choking incident or a severe choking incident. A mild, we just let them cough it out as a reflex so that the choking or the material that chokes them can be removed from the airway. But for severe, those who have cough without any sound, we have to intervene. Again, for conscious patients, we do Heimlich maneuver, putting it in the center, doing abdominal thrust. For unconscious, that's when we do a CPR. For less than 1 year old, as Dr. Dan also demonstrated, we do 5 back slaps, then we do 5 compression, then again check the foreign body on the oral area, on the mouth area, and then we do repeat it and ask for help. And until help will be given, either we'll be lucky to remove the foreign body, or we'll have a more competent healthcare professional to take over. And again, we have to do check, we call, and we care. So first aid in children, for a fact, early CPR saves lives. We check for scene safety. We want to make sure both the kid and us parents or those who would take over, would help the kid, will have to be safe at all times. Then we shout and tap, check for consciousness of the patient. Either we shout or tap, and if there's no reaction, check for chest rise to if the patient is still breathing. And then that's when we do 30 compressions. We check the airway and we do gentle breaths. But if you will not do the gentle breaths, and if you're not comfortable giving breaths, it's okay to do a CPR only or a hands-only CPR. That means we don't give the CPR, the gentle breaths, but we still do the compressions until again the help arrives. So I guess that summarizes all that Doc Dan expounded a while ago, and I hope these things can be reiterated to everyone who's attending this webinar. That's it, Patricia. I guess we can proceed with some of the questions.
Yes, and for that, we'd of course like to call back Doc Dan. Please join in this conversation. I'm really just here to listen as a parent as well, and I really appreciate also that summary that you gave us, Doc Austin. So we have now Dr. Dan, and you guys have a tall order. We've got a lot of questions. So Doc Austin, go ahead and ask those questions.
I saw many of the questions, and we'll try our best, Doc Dan, for sure Doc Dan will be able to answer. One is, it's from Mr. Cortez from Optum Global Advantage, and he's asking if a child fell off in an elevated area, for example, stairs, roughly 10 to 15 feet high, should we rush the patient or the kid to the hospital, or is it wise not to move the child and just wait for an emergency response team?
Yes, thank you. That's a very good question. First off, I have to say, though, that I'm very impressed with Austin's summary. You have to know that he didn't have the slides ahead of time, so he did that on the spot. And he managed to cover all of the important topics. Of course, these are things that Austin is very experienced in dealing with as well. No, so a couple of things on that question. No, so number one, I'll start from the end. Should we not move that child? No, so the concept of not moving the child comes from there may be some injury, especially to the neck area, which could cause damage to the spinal cord and maybe paralysis later. No, and so for moving, if we have doubts of the neck, especially, we want to not move that child and leave that to qualified health professionals. No, so the reason we don't want to move them is because of the possible neck injury. For the head injury, though, if there was a significant trauma, like fell from 10 to 15 feet, that's definitely a significant height. And so we would want to get that child checked out. We just have to be ready, I think, as parents, no, to know that we will get the child checked out. And a lot of times you will either be cleared just to go home, or either immediately or after a CT scan, after the initial evaluation. And the important part is really the next 24 to 48 hours. So what we'll do really is to advise you of the things that you need to watch out for in the next 24 to 48 hours, because the bleeding and therefore the symptoms can actually develop over that period of time, and we need to watch out for that. So we'll check for them obviously when we see the child, which is probably going to be maybe 30 minutes to an hour after the injury, but you need to keep on looking out for those things for the next 24 to 48 hours.
Thank you for that, Doc Dan. We've seen a lot of parents being very curious about if their kid would have to do CT scan in the ER or not. And number one is the one that you mentioned a while ago, Doc, and another person asked it on our chat box. Is it correct not to let the child sleep if he falls and hit his head?
Yeah, so I think I mentioned that earlier. No, really, there's no problem letting the child sleep. We'll need to observe their wakefulness pattern for the next 48 hours.
Okay. Another thing is, Doc, is it advisable to put Band-Aid on the open wound?
So I would say in general, yes. The best environment for wound healing is a moist, closed environment, not necessarily an open, because it's open to infection. So we'd want Band-Aids have a medicated gauze, which keeps the area moist and keeps infection from setting in. So it's best to put some kind of bandage on open wounds.
And how about, Doc, on the wounds on the head with hair? Do we have to shave it, or we just let it?
Yeah, so the shaving is usually done to facilitate suturing. Like if I have to stitch the wound because the stitch looks like hair, and so it'll be difficult to differentiate the hair from the suture, and also the hair can get into the wound causing infection. So that's why sometimes they shave the area. But if we're not going to stitch, then there's no need to remove the hair from the area.
And sometimes you use it as a suturing,
Sometimes,
some
yes,
form
you
of
use it.
suturing device to
Yes, you can use
oppose
the
the
hair
wound.
itself to as a shoelace almost. Yes,
Right.
correct.
How about burns, doc? For number one, there's a concern if the running it in top water, the burn area will cause blisters. Will it
No,
cause? Mhm.
yeah, no. So it may seem that way because the inside of the blisters is clear fluid, but that fluid is coming from inside the body and seeping up into just under the skin. So the tap water is not actually going in and causing the blisters. And as mentioned, the reason we want to run the tap water is to remove the heat, the offending agent, and also remove any dirt that may cause infection in the area.
And, there is also a question of what do we call that fluid underneath the blisters?
Well, I mean, we call it transudate.
Right.
But basically, it's just fluid that kind of seeps in when the body is injured or there's something wrong going in there. It kind of opens up the blood vessels and allows things to seep through, like white blood cells and things to fight any infection, etc. And often there's just too much of that fluid, more than we
And
want.
once it leaks, doctor, is it okay to just apply the ointment and do the dressing?
Yes, actually, there's two schools of thought. Some people would want to unroof or remove the blisters and flatten them out. Some people would want to just leave them intact and cover them with dressing. No, so personally, I prefer to leave them intact if possible. Though there's a big chance that they may rupture on their own, just because you still have that closed layer if you leave the blister intact. And if it bursts, then you'll have an opening no matter how small. So
Right.
it's best to just leave them intact, cover them with the burn dressing, and then with gauze. That will pad it also and help prevent the rupture.
With the burn ointment, doctor, is it an over-the-counter drug or do we need prescription for it?
You know what? I believe it can be bought over the counter, although here in the Philippines it's a little flexible. I mean, you can usually get things over the counter. I don't think it's a prescription drug. We should note, however, though, that it's not suitable for those with sulfa allergies because it's a sulfa-based.
Mhm.
Silver sulfadiazine is sulfur-based ointment.
And is it applicable for any degree of burn?
Well, you don't really need it if you have a first degree burn. But as mentioned, kasi right after the burn, it may look like a first degree burn, but a few hours later, it may develop blisters or peeling off of the skin. So we teach the doctors who see patients to treat any first degree looking burn as a second degree burn. Now, if you're at home and you can observe it constantly, then if there's no blisters and no peeling of the skin, then there's no need to apply the burn ointment.
We have last three questions, doctor. Number one is accident fishbone injury or stuck on the throat in toddlers. What should we do?
Yeah, so if the actual a lot of times the fishbone will scrape the throat on the way down and cause wounds, and it feels like it's stuck in there, but often it really isn't stuck in there anymore. But there are times where it is really stuck in there, and in those times we really need special equipment to be able to pull those fish bones out. You can try initial measures like usually they swallow rice or bananas or something like that to try to pull it out, but there are times where it's just really stuck in there. I'm sure Austin also has removed his share of, even really long fish bones in the throat.
Yeah.
Sometimes it happens, unfortunately.
So we just have to go to the ER for
Yeah,
evaluation. I
if we
guess that.
really think it's in there, it's not
Mhm.
going away after a couple of days, then we may have to have it looked at with some equipment.
How about CPR, doctor, for children? Is there any difference in tempo if you're going to do CPR, children and adults?
So for the tempo, no, it's still 100 to 120 per minute.
Mhm.
And then there are just some subtle differences that aren't really as important, and it may even complicate the thing. So we just should know 100 to 120 in the center of the chest is the most important thing. I didn't cover giving the breaths today because there
Mhm.
wasn't a lot of time, and also that's something that you should really try to practice in with a
And actual,
mannequin. Yeah,
right?
because no matter how much you lecture it, you won't get that feeling of doing it. But there are courses that you can take where you'll get to use a mannequin and learn how to really do that.
That's true, Doc. And lastly, Doc, this is my last question from the list. His son often holds his breath when he's crying. Is that normal, or what do they need to do?
Yes, as a matter of fact, that is a common cause of ER consults for infants, of course, as Austin knows, and that we call it infant breath holding.
Children.
And that happens in small children. Sometimes they just kind of forget to breathe, and they can do that to a certain extent where they even turn blue. But it will never be to a point where they hold their breath until they die. That won't happen. So sometimes it does happen, but they grow out of that.
Thank you, Doc Dan, for answering all those questions.
Thank you also, Austin.
This. I'll get back to Miss Patricia.
Yeah, it's so helpful, honestly. Even that last question, that's a clincher.
Right.
That was really good because my baby used to do that. I would have to breathe into her face. Para biglang magulat
Right,
siya and
yeah.
she will breathe. Diba? Ang dami. I wish we had more time, honestly. I learned so much. And as a parent, this is very, very important to me, for me and my children to live our best lives. Now, I'm going to ask Doc Austin. You had a really great summary of what transpired. I took shots of the screen so I can remember. Hindi mo lang nalagay yung staying alive.
Oh, because I
Pero
use
okay,
rumor
so-
has it. Baka yung staying
Yeah.
alive, millennials wouldn't know.
Actually, there's a whole Spotify
Hey.
playlist of songs that you can do
Exactly.
CPR to.
Oh, di ba? Gusto ko yan, Doc Dan. Now, before you both go, may I ask Doc Austin first, what's your parting message for all of us who are listening?
Well, my parting message, as it's been emphasized over and over again, please do not panic. There are things that are normal and there are abnormal. Just letting you know that there are things that you have to consider. And if all else fail, if you're unsure, please do not hesitate to go to the hospital and let healthcare professionals take over. And that's it.
Thank you for that reminder. Yes, I love that, Doc Austin. Thank you so much. Dr. Dan, thanks again for that wonderful
you.
talk. Really extensive, and we really appreciate it. And your final thoughts for this Wellness Friday.
Yeah, actually, I think Austin said it best. As parents, we try our best, but we can't prevent our children from encountering some scary situations. The most important thing is to be prepared and try to be aware of the accidents and prevent them. And also, like Austin said, really, if you're not sure, just consult your doctor. No problem. I mean, it's very understandable that we're not sure what to do, and we'll help you out.
Thank you so much, Dr. Austin Gawaran and Dr. Dan Luchanco, for this wonderful, wonderful discussion on first aid in children for our Wellness Fridays event.
Thank you,
Take care.
Patricia.
Thank you, Patricia. Thank you, Doc Dan.
Night, everyone.
Bye.
Now, that was such a valuable experience for all of us, all of you Maxicare members today, and to our attendees. Thank you so much for participating and staying engaged all throughout. I know you still had a lot of questions, but I'm sure you also got so much information. To our dear Maxicare members, may we invite you to please take a few moments to answer a feedback form after this event. Here's the link that we're sharing with you on the chat right now and the QR code that's on your screens. Your feedback would be most appreciated. And this is why we keep doing all these great events, because of your feedback. So thanks so much for that. Now, we will announce the winners of our raffle draw. Remember that? The winners were randomly selected by our staff from those attendees who got to share their most memorable Wellness Fridays topics and why. So again, one winner will receive a laptop bag, another will get a foldable umbrella, and one will receive a mini clutch bag. All of these prizes are great, and they are going to the following people. Congratulations to Leamor Tolentino from Tamic Automotive Philippines, to Rochelle Jalyn Tan, and to Delia Fuentes Pina. Wow, we've got really great attendees here. Congratulations, and thanks for sharing why and which topics really meant a lot for you in your wellness journey. We appreciate you. Now, please don't forget, if you haven't done so yet, to chat with us, your full name and your contact details, so we can get in touch with you about the prizes. Now, before you go, we still have some poll questions that we want to ask you, and here's the first one. Now, which topics in relation to what you learned today would you like to see in our next Wellness Fridays? And of course, we had a great conversation today about first aid. What about the next one? What do you want to learn about next? Productivity hacks for work from home employees, nutrition talk for the holiday season, I think I need this, AIDS awareness, managing diabetes, or emergency preparedness. I like that. These are great topics. And of course, we will go by what you guys think. So let us know. Let's show the result of our poll. A lot of people want emergency preparedness. And I did get a text about earthquake drills and all that. Now, I need to go to these Maxicare events so I can be really prepared. And productivity hacks are also going to be one hot topic. So watch out for the invites for those. Now, here is my series of next questions on a scale of 1 to 5, 5 being the most. How do you think this webinar series will help you live your best life for this particular topic? Please score it 1 to 5, 5 being the most. And if you scroll to the next question on the same pop-up window, it'll ask you on a scale of 1 to 5, 5 being the most, how likely are you to recommend the next events to others? So go ahead and answer that while I share with you how you can share all the information that you got here on your social media. Please do use the hashtag Live Your Best Life and the hashtag Maxicare Wellness Fridays. And please also tag Maxicare, and we will show you just shortly these social media handles. I know that a lot of you are still answering the poll questions, but I think most of you have already answered those polls. So we don't need to see them, but we do appreciate your insights for them. So again, if you guys really enjoyed everything that you experienced here, please do share it on your social media. We have the hashtags, and we have the Facebook handle Maxicare Healthcare Corp, the IG of Maxicare Healthcare, and the Health and Wellness IG at Maxicare Health and Wellness. And you can tag them when you share about your wonderful takeaways from today. And please don't forget to also subscribe to their YouTube channel, and it's at Maxicare Healthcare Corporation. Now, I know that a lot of you want to learn more about Maxicare's products or maybe share some information about the products. Please go to or direct them to shop.maxicare.com.ph, or you can send them a message through their FB Messenger. If you have questions about Maxicare's Wellness Fridays, please send an email to maxicarewebinar@maxicare.com.ph. So I'll see you guys on our next Maxicare Wellness Fridays event, which will be on November 19th at 5 p.m. as we talk about the sweet life by managing diabetes. Wow, I like that topic title. And this will be with Dr. Michael Villa. The QR code is being shared on your screens right now, so capture that. And of course, we are also going to be sharing information on different platforms and social media sites. And you guys can also check out the chat as a reminder for all of you when and what time. But that ends our event for today. Thank you for being with us this evening. We hope that you enjoyed and you were able to take away meaningful information, especially for the young ones. Thanks again, everyone. Have a great evening. And we know that with Maxicare, we can all live our best lives.